Now, the Vaal and Soweto have been identified as areas of concerns as COVID-19 numbers increase in Gauteng. There are reports that people there are flouting lockdown regulations. Added to this is the concern of a lack of hospital beds in the Vaal. Our reporter Nqobile Madlala is in the Vaal and joins us now live. Nqobile, as you heard earlier, there's quite a lot of concern in terms of the Vaal and Soweto being sort of the epicenter here in Gauteng. What are you seeing out there? Are people following the regulations?
Well, Maseko, really concerns. We heard this from last week from the clinicians, along with Makura speaking about the issues that they're seeing on the ground. But right now, before we get to the Vaal, we are going to unpack what the numbers mean at this point. We are joined here by Prof. Bruce Malada. Perhaps, Prof, can you please give us an idea of how the numbers are looking right now as we enter the third wave?
Thanks for having me. So, first of all, what we do as a committee is we look at the large number of indicators, and they all seem to be consistent with the picture that we are in the middle of a resurgence. So if you look just at the number of positive cases, you can see that this week the average number of cases is going to be about twice as large as last week. That's obviously a very big source of concern. The previous week was about 60% higher than the week before. So that really means that we are in a trend, and an upward trend. But not only do we look at cases, but we also look at mortality, excess mortality, hospitalizations, and mobility patterns, and we also build risk indexes and advanced analytics on that basis. So everything points to the fact that we are certainly in the middle of a resurgence, unfortunately.
Prof, can you give us an idea then what is it that you saw in terms of the numbers? What are the numbers saying? Because I understand that you were saying that we will be seeing the wave, but it changes from Monday to Sunday, well, according to the day of the week. Can you just explain to us what will we be seeing?
Right. So what we have been experiencing over a number of months, already for quite some time, is that you have what we call an epidemiological week, where the numbers are typically low on Monday, Tuesday, and then they shoot up Wednesday, Friday, Thursday, and then wane on the weekend. So if we see, for instance, the next couple of days, we are now on a Saturday, the numbers will be announced. There will be numbers on Monday and Tuesday. If those numbers go down, it's not because the resurgence has stopped. It's because we have a modulation within the week. So what you have to really look is at the average of the week with respect to the previous one. When you do that, you realize that we have a serious increase in the numbers.
And we do understand that the Vaal and Soweto were one of the areas that you flagged last week, talking about the fact that these are the hotspots areas. Can you perhaps give us an idea what is the latest on hotspots?
Right, so we just got data from the Department of Health that we analyzed as quickly as we could to perform a detailed hotspot analysis, and indeed what we see right now is an increase in the number of hotspots. That's also a very worrisome effect that comes with the resurgence, not just the number of cases, but how they are clustered together. That's very important. For that, you need a very specialized analysis. And what we saw yesterday, it was an increase in the number of hotspots in the province, and specifically in the Citibank area, we see a very serious resurgence, which has been discussed already for weeks, and now has accelerated. But unfortunately, it's not only Citibank. We do see a similar resurgence in some of the sub-districts of Tshwane and Johannesburg, which basically is an indication as a result of people moving, that the virus now has been activated to become quite active in terms of the growth and the acceleration. So we do see an acceleration in number of sub-districts, and that is typically how a wave begins. A wave doesn't begin with very large numbers or all the sub-districts being active equally. It basically starts in some districts, and because of mobility, moves from one district to the other.
All right, and what can we expect then going forward, considering the fact that we are now in the third wave?
So what we do is we monitor all the data as they come, almost real time, because now is really the time where we have to be extremely alert about the growth. So the data from the next week is going to be absolutely critical for us to understand what does this wave mean in terms of how many cases we expect, what will be the peak, when will the peak take place, and when will the peak be waning down. So for that, because there's so many uncertainties, you really have to look at the data and interpret the data as the data comes. So the first wave the next week will basically tell us a lot about how the next week will be with respect to this, and that will give us already enough understanding of what kind of acceleration we're dealing with. And that with other measurements that have been unveiled by the Department of Health, such as the seroprevalence, the fraction of the number of people that we think that are infected already, we're going to have a much more detailed understanding of where we expect the numbers to be biggest, and how fast the pandemic will grow. So we're basically in a mode where we are on a daily basis analyzing data to understand what this resurgence means and what are the implications of the resurgence in terms of resource planning and whatnot.
Lastly, Prof, we heard last week that we're expecting this wave to not hit us as hard as previous waves, but we had already heard that the numbers were bigger than before the second wave. Is this then the time for people to let their guts down? What do they do at home?
First of all, I mean, we have to be cognizant of the fact that predicting something is very, very difficult because there's a lot of uncertainty. So, yes, there are educated guesses and educated modeling that can point to the fact that, yes, the third wave could be worse, but also it could be not so bad compared to the second. So there are outcomes that would cover a wide spectrum of possibilities. But what we do is to monitor the situation very closely to extract those models from the data. What the data is telling us is that we are in the middle of a resurgence. So this is now not the time to act recklessly or not to adhere to social distancing, because it is within our power, through our behavior, to ameliorate, to slow down the resurgence that we are in the middle of at the moment. And slowing down a resurgence means saving lives. It's as simple as that. There's a one-to-one relationship between that. So now is the time, as already the Premier has indicated and has already sounded the alarm, to adhere to level 1 regulations. Because the problem that we have at the moment, we receive a lot of reports of level 1 regulation not being adhered to. And that is a very serious problem. Now, when we have low numbers, that may not have a direct consequence tomorrow, but since we are now in the middle of a resurgence, it does have very serious consequences. So we appeal to the population to please adhere to social distancing and adhere to level 1 regulations.
Thank you very much, Prof. Prof. Malada de Masejo, just explaining to us what the numbers mean at this point. We have heard in the past that Soweto and Vaal are the areas of concern, but you're hearing now from the Prof saying that Tshwane, some of the districts in Tshwane are also showing that cluster, which is a concern as well. We are going to be going on the ground, Masejo, to give you those details with regards to whether people are adhering and if they are listening to that call that Prof and the Premier have said to them.
Right, we'll leave it there. Thank you very much, Nqobile Madlala.